Have you ever had to use the restroom, but you just can't seem to go? And you feel like if you don't go immediately right now, you're going to pee your pants. And you know, I hate to break it to you, but if you're having those symptoms, you're probably going into retention and you should probably get to the hospital before your bladder actually does explode. Today, I'm going to be presenting and demonstrating how to set up a catheter insertion. Okay, I'm going to present my supplies. So I have a medium, large, and night leg bag. This is where the urine will be draining into. I have a sodium syringe, 10 ml syringe, lubricant, iodine swabs, our 16 French catheter. This is the most commonly used catheter, as well as sterile gloves. So this procedure is a sterile procedure. It's best that it's kept sterile because we don't want to introduce the patient to infection. So we're going to start off by applying our drape. So it's important that when we open this drape, we open it correctly because it could sterilize or compromise the sterility of this package. So we're going to open it, pull the paper apart. In this package is the drape. So when I show it to you, you can see that there is a line. We cannot touch above this line. If we touch above this line, it is going to not be sterile anymore. So we can only touch within this border. We call this the 1-inch border. I'm gonna go ahead and open it very slowly, very carefully. And the way we place this is important as well. So you see right here in the middle how it's kind of indented inwards. That's incorrect. We wanna face it where the middle is poking outwards. So when we fold it, it pokes outwards. So we're gonna place it on the tray very carefully. We cannot cross this field because then we will compromise it. Very carefully, we place this on there. Okay. Now, we're gonna place our lubricant. So we're gonna open this and then place it right in the corner. Now I'm going to place my iodine swabs. These are a little messy and I don't really like them that much, but you know, here we are. So we open it very carefully. You're probably going to get iodine on your fingers, probably on your clothes. Be very careful. You're going to fold it this way and let it drop on the tray. It's super messy. There you go. Thank you. This is our sodium chloride. This is what's going to keep the catheter inside of the patient's bladder and keep it from falling out. So this is actually not a sterile syringe. And it says on the packages that it's not sterile, but we still use it sterilely. We just cannot touch it once we've opened the package. The way we do that, we open it very carefully and pop it on the tray. Okay. Now, with the catheter, this is a little tricky because inside of the packaging, the catheter's in another package. So what we're gonna do is we're gonna open it and place it on the tray very carefully because these fall so easy. And once it falls, you have to get a new one. And it's not fun. Okay, so now that we have all our supplies on our sterile field, we're gonna open our sterile gloves. We put these on very carefully as well. So I'm gonna open them flat. So this fold right here is not sterile, so I can touch it with my bare hands. And I'm going to insert my hand inside of the glove and place them. And then with my other hand, I can grab my other sterile glove with this hand because it is now sterile. So I have my other glove. I'm gonna go ahead and put it on. Now I'm going to kind of just organize my tray a little bit. I'm gonna put the sodium chloride there in the corner. I'm gonna open up my packaging to the catheter very carefully. I'm gonna place the tip of the catheter inside of the lubricant. Then I have my iodine swabs here. And that concludes the setup for our tray. I'm gonna get unsterile. Now with our bags, this is completely up to the patient's discretion. A lot of patients like the leg bags better just because they're more discreet, and it's kind of a little bit embarrassing for them, so they put them on under their clothing. Whereas the night bag, some patients prefer this one because it's a little bit easier. You don't have to change as often, but it's not the best to look at. And so it kind of just depends on the patient and what they prefer. Okay, so I'm just gonna use the medium leg bag so I can kind of show you what it looks like. So open this here. This is not sterile, so we can touch this. That kind of landed on there, but that's okay. All right, and so here's what the leg bag looks like. And this will be connected to the patient's leg. And then these straps here will hold it on the patient's leg. And this tubing right here will connect to the end of the back. And then this end right here will connect to the catheter. So yeah, that's how you set up a sterile catheter insertion. All right, make sure to like, subscribe, and leave a comment. So this is our sodium chloride. This is